The other thing you want to also keep in mind is that a heart attack, when you think about it, we refer the symptoms to what a man would feel, a male would feel. So, you may have heard the term of a heaviness on the chest, that it feels like an elephant on your chest. And that's sort of the generalized idea of what a heart attack looks like. But for a woman, that presents and can present very differently. So it can present with just really, really, really significant fatigue that cannot be explained by, adequate sleep, adequate nutrition, adequate exercise, and you're still feeling so exhausted. That could actually be a symptom of cardiovascular disease and maybe a heart attack. Many women will even talk about having some neck pain or shoulder pain or back pain. And typically, we would not associate that with heart conditions, but that is actually another symptom of a heart attack for a woman, that she may not even present to the emergency department because she's not having that, elephant on her chest heaviness on the chest as a male would. And so we have to be aware of how our heart condition can present very differently for us compared to a male. Next slide, please. And the
I'd like
last,
to ask you, sorry, a quick question, Shafeena. Sorry to interrupt. But
that's
when you were
okay.
talking about back pain, there's a large area. So where might a woman feel back pain that could be related to a cardiovascular incident?
You know what? There isn't really a particular area. It could be sort of in between the shoulder blades. It could be just literally on the lower, on the sort of just behind the shoulder as well. There isn't one really particular place. And so, when you present to your doctor and you say, I'm having back pain, the initial thought would be, okay, let's get an X-ray. Do you have some sort of issue in your cervical spine, or do you have sort of an issue with your mid back or something? Maybe you're exercising. And so what's really important is that when you go to your doctor and you say, I have back pain, you also need to provide more information about other symptoms that are presenting. Like,
Right.
did you recently exercise and did you have trauma? Then it would be more like, MSK, muscular. But if it's like all of a sudden shoulder pain that you don't otherwise have had a trigger for, then you need to be thinking about, okay, what else could this be? And don't always assume that that's what it is. I remember there was a patient who came into my office. I was a first year practicing physician, and all she came in with was shortness of breath. Her mother had just passed away. She was very stressed out. She was feeling short of breath, and she's like, I need an inhaler. I feel like I can't breathe. I was like, no problem. Let's look at this, but I think we should work this up a little bit more. And I sent her for cardiac imaging, an exercise stress test, and an echocardiogram. She had that done within 1 week. And a week later, she was getting a stent put in place. So
Oh,
this was all
wow.
cardiac. And all she thought was this is stress. And I'm feeling short of breath. Maybe this is something to do with my asthma. And so really listening to what the patient's symptoms are and then looking at her other demographic, um, you know, risk factors, like what is her age? Does she have diabetes? Does she have high blood pressure? If you have more and more risk factors, don't always assume back pain or shortness of breath is, MSK pain or respiratory issues. It could very well be cardiac. So we always need to keep that in mind. And the more information we have from the patient and understanding what that patient's individual risk factors are will help us to determine whether this is cardiac in nature or not.
This is great information because you're absolutely right. I think most people think of that male symptom of clutching that your
Yeah.
chest, with that heavy pain, and it doesn't present often or always like that. So it's really great
Sometimes it's even
reminder of
just
this.
actually arm pain. I forgot to
Yeah,
mention. Sometimes the
yeah.
woman will just say, I'm having this weird arm pain. I don't know what this is. I haven't
Mhm.
done anything funny. I haven't lifted anything. I haven't been exercising. There's been no falls. What is this?
Yeah.
Again, think heart.